Shadow Chancellor Anneliese Dodds told the Marr show on Sunday the 5th of June, "I'm not going to say to you that Labour is going to be advocating some massive grand scheme right at this moment when social care is in crisis. But we need grand schemes exactly at this time of crisis. The Tories' floundering has imposed a massive grand COVID-19 death toll, threatens a massive grand risk of a whole new second wave of the virus, and is generating massive grand job cuts. As the Safe and Equal campaign has revealed, an official survey has confirmed that a lack of isolation pay and insecure work has increased the risk of care home residents getting the virus. The Vivaldi study surveyed 9,081 elderly care homes. It found the risk of infection was reduced by 7 to 18% when staff had sick pay, and almost halved when care homes had regular and permanent staff rather than using bank and agency workers on 0-hour contracts. The 7 to 18% figure must be an underestimate, because 93% of care home managers reported they did give sick pay, and government figures say only 40% do. Maybe the managers thought the meagre Statutory Sick Pay scheme, which is a binding legal minimum, counts as giving sick pay. Both the government and the scientists who criticised it say that finding people with COVID-19 symptoms, testing to confirm, tracing their close contacts, and getting sufferers and contacts to self-isolate is central to controlling the virus. That can't be done unless sufferers and contacts, who will probably have no symptoms, do self-isolate. They must have isolation pay to make it economically possible, and if they live in crowded housing, special accommodation to make it physically possible. We need a grand scheme to ensure the provision for all workers and all industries, and a grand scheme of bringing all care homes into the public sector with workers on public sector contracts, pay and conditions, and we need that now. We need a public health test and trace operation run by properly funded local authority public health departments, not the Tory botch under which half the testing is contracted out through Deloitte and half the tracing is contracted out through Serco. We need private hospitals to be requisitioned, taken into emergency public ownership to enable the NHS to catch up on all the treatment delayed at the height of the pandemic and to secure capacity for a second wave of the virus. We need workers' control over safe reopening of workplaces to avoid workplace infection clusters such as have been in central to the outbreak in Leicester. On jobs, Boris Johnson says he has a grand scheme, a New Deal, but it's largely bluster. The Labour movement should have a real grand scheme. Nationalisation of the big firms declaring job cuts like BA, Airbus, EasyJet, Rolls-Royce, and retraining and retooling to redirect the workforces to green and socially useful production. A big expansion of public sector jobs in care, in the health service and in local services to give good alternatives to workers losing jobs in cafes, pubs, shops. A shorter working week across the board, a new standard of 32 hours or 4 days full time with no loss of pay to share out the hours and push back overwork. The Tories are forcing the pace with reopening because they want to stop paying out furlough money. Thus, their risky opening of pubs on 4th of July and simultaneous reduction of the 2 metre rule to 1 metre. If Britain were able to continue the improving trend of May and June, then it would be possibly by late July to get confirmed infections down. Not as far as remote islands like New Zealand or Iceland, but to 2 or 3 per million of Denmark, Norway or Finland. From that level, experience suggests it's medically possible to control the virus in a sustainable, long-term way, maybe with localised outbreaks and quarantines, but no worse by means of careful contact tracing, working from home, quarantining cross-border travellers, masks, moderate COVID distancing, screens and hand washing. To make it socially possible to do that and to avoid escalating mass unemployment, make Labour fight for those massive grand schemes.